and I call the member for Fisher.
Thank you, Madam Deputy Speaker, and I acknowledge the service that the member for Kingston provides to the Veterans Affairs community and her work in that area. Madam Deputy Speaker, this government could not be more committed to understanding and promoting the health, and in particular the mental health, of our veterans community. In 2016, the government released the most statistically robust study of the mental health, and in particular in relation to the suicide rates of the Defence Service personnel. That was the most robust study that had ever been done before. In 2013, of the 148,000 veterans with service-related disabilities being supported by the Department of Veterans Affairs, 46,400, almost a third, were living with an accepted mental health disorder, including post-traumatic stress disorder, anxiety, depression and substance dependency. In the 13 years to 2014, there were 292 deaths by suicide among people who had served in the ADF for at least one day since 2001. Among male veterans, the suicide rate was 13% higher than for the equivalent general population. Given that the statistical data was so limited in relation to women serving, I'm unable to provide the data in relation to women, but I'm not trying to take away from anything in relation to the service of service women. Among male veterans aged 18 to 24, the suicide rate is twice that of their peers. There have been 23 deaths since 2001. So what's the government done? In this year's budget, Madam Deputy Speaker, we've increased the financial support by $350 million to support our veterans. Last year's budget made treatment for depression, post-traumatic stress disorder, anxiety and drug and alcohol misuse free for anyone who had served in the full-time ADF. In this year's budget, we've extended that to all mental health conditions. We've increased the budget by $33.5 million, and importantly, there is now no need to prove that a condition is related to their service, and funding has not been capped. All veterans with a mental health condition have access to the Veterans and Veterans' Families Counselling Service. The government has provided $8.5 million in this budget to extend this service to all current partners and children of veterans. Also, former partners of ADF personnel up to 5 years are also eligible after the couple separates or while they are co-parenting a child under the age of 18 years. $9.8 million has been provided to pilot a new approach to suicide prevention and improve care and support available to veterans. And I'm hopeful, Madam Deputy Speaker, that some of this pilot money will go to the Thompson Institute to research PTSD for veterans. One of the best ways to ensure good mental health is to ensure employment. The government is providing $2.7 million for the Prime Minister's Veterans Employment Program launched in November of last year. This money will be used to help businesses understand the unique skills that former ADF members can bring to a job through supporting the Industry Advisory Committee, creating an ex-service organisation industry partnership register and developing the annual Prime Minister's Veterans Employment Awards. $9.1 million has been provided for accelerated access to rehabilitation services, streamlined access to incapacity payments and improved access to the totally and permanently incapacitated disability pension for veterans working past the age of 65. DVA is further committed to implement a suite of initiatives to support members to successfully transition out of the ADF, such as conducting a 2-year trial that will allow veterans to access medical treatment while their Military Rehabilitation and Compensation Act claims are processed. This government stands by its veterans, Madam Deputy Speaker. As the Prime Minister has repeatedly said, the best way we can honour the memory of our Anzacs is to properly care for our ex-servicemen and women.